Did you know, as of January 1st, 2020, Medicare will pay Medicare Enrolled Opioid Treatment Programs to deliver opioid use disorder treatment to Medicare beneficiaries? Today's tip is not all-inclusive, and it is not intended to be comprehensive. Please utilize the URL references contained in this educational video for more information. Are any of your providers delivering opioid use disorder treatment to Medicare beneficiaries? If so, the following information is important. So take a moment and share this information with your provider and billing staff. The list on this slide represents an overview of the types of services now covered by Medicare, such as FDA-approved opioid agonist and antagonist treatment medications, as well as dispensing and administering medications, substance use disorder counseling, which can be either individual or group therapy, toxicology testing, intake activities, and periodic assessments. Professionals who can provide the substance use counseling and individual and group therapy included in the Medicare bundled payment may include licensed clinical social workers, licensed professional counselors, licensed clinical alcohol and drug counselors, certified peer specialists permitted to furnish this type of therapy or counseling by state law and scope of practice, and others who are permitted to furnish this type of therapy or counseling by state law and scope of practice. If the individuals furnishing therapy or counseling services are not authorized under state law to furnish such services, the therapy or counseling services provided by these professionals would not be covered as OUD treatment services. First, the provider needs to enroll as a Medicare Opioid Treatment Program, OTP provider. The Centers for Medicare and Medicaid Services, CMS, is now accepting and processing OTP enrollment applications. Your organization may enroll as an OTP provider if you meet certain criteria and applicable Medicare enrollment requirements. Your program must have current, valid, and full certification by SAMHSA, the Substance Abuse and Mental Health Services Administration, and it must meet all the criteria required by SAMHSA, including but not limited to Drug Enforcement Administration DEA registration, state licensure, and accreditation. Your Medicare Administrative Contractor, MAC, will verify your SAMHSA certification on the SAMHSA OTP directory. You must send your letter of certification from SAMHSA with your Medicare provider enrollment application. This is the URL to view OTP by state. MACs will not accept applications without full SAMHSA certification and will deny application for OTPs with provisional SAMHSA certification status. For information on SAMHSA certification, please visit the samhsa.gov website or use this URL here.